Hi, my name is Dr. Victor Dominguez. I'm the medical director at the Centers for Family Health in Ventura, California. We have 11 outpatient centers, family health, but we also have specialty care at these facilities, and we also have primary care, including family practice, internal medicine, pediatrics, and we have OBGYN. Let me introduce you to a concept that we are implementing at this time in our Centers for Family Health. It's called the Patient-Centered Medical Home. When I first introduced this to a lot of my patients, they asked me, "Are you going to come to my house and take care of me?" I tell them, no. The medical home is here at this practice. So what I try to make them understand that the Patient-Centered Medical Home focuses on them, the patient. And I'm here to work with them in a kind of collaborative effort to not only treat their medical condition, but find out what are their needs, what are their specific needs as an individual, and try to get a better understanding how I can work with them in a team kind of format so that I can maximize their treatment for their medical condition. But it just doesn't involve me. It involves my whole team, which is everyone that I work with, not just at my center, which includes other providers, medical assistants, physician assistants, nurses, but it includes other doctors at the other 10 centers, because we're all, in essence, taking care of this patient, because I may refer this patient to one of my colleagues at another center for either a consultation for a specialty consult, or they may end up there at the urgent care, or I may not be available and they may end up seeing one of my other colleagues at another center. So in essence, these providers need to really understand what I have done for this patient and the treatment program and how we're managing their medical condition. One way that we try to do this is through a medical healthcare system, which we've been using now for over 2 years. All of the physicians in our centers share the same medical records. So in essence, my patient's record can be seen by any of the other providers in our network, all within HIPAA regulations and confidentiality. It's a plus in that it's no longer a siloed medical record that only stays at my practice, but all providers can input any important, pertinent information into that record, which I can then look at in the future and address if needed. The important thing about the patient-centered medical home is that once that patient leaves our centers and they end up at the ER, or they end up at the hospital as an inpatient, those providers at those facilities also will have access to that patient's medical records using our electronic health record. And there's this great collaboration going on right now between the outpatient providers and the inpatient providers to try to maximize the care of these patients that may end up there for more aggressive inpatient or ER treatment. In essence, once those patients are evaluated at the ER or they're admitted to the hospital, once they're discharged, we're developing at this point a good process in which there's a great transition of care, so that as a primary care doc, I know exactly what the patient has gone through in regard to their treatment, their management, and the recommendations that have been made by either the ER provider or the inpatient provider, so that that patient transitions to me seamlessly without having any issues in regards to having access to more treatment, and making sure that all their questions and concerns get answered immediately. So the important point that I try to tell my patients about this whole concept of the patient-centered medical home is that they need to be proactive in their care. They need to be aggressively involved in their care, not just by showing up to my appointment and seeing me as their provider, but really getting involved in regards to asking questions, being proactive and not just doing what I tell them, but sharing with me what they think would make them better in regards to their health. And it kind of changes the mentality of the provider, in that in the past we kind of just gave directions to patients and told them, here, take this or take that, do this, do that. But now we kind of have to start listening more to our patients and their caregivers and their family members, and try to work in collaboration with them and how to maximize their care. In essence, it's a unique visit, it's a unique patient, and that's the way this whole concept works, to try to feel like that patient is really coming to their home and they're going to be treated appropriately and to the higher standards of care.